Hello, beautiful mamas, and welcome to the Balanced Mama Project Radio. This is a short and sweet, where we keep it short and sweet. Today, Dr. Say is going to take us through learning about vascular changes in pregnancy. So, what is it? Let's get started. Dr. Say, hi.
Hi.
So Dr. Val, would really like to know more about vascular changes. Why do some people swell in pregnancy?
Okay, so when it comes to swelling during pregnancy, and the vascular changes, we have an increased amount of blood flowing throughout the body. And with the different hormonal changes, the vasculature, so when we say vasculature, we're talking about veins. Think of blood vessels. So what is carrying your blood through your body? So veins, arteries, things like that. The vasculature becomes more relaxed with the hormonal changes in the body. And so this can make it more likely for folks to have swelling in the legs.
Okay, very interesting. So how does that show up clinically? You mentioned swelling in the legs. How does that show up in the clinic?
So, if someone is coming into the clinic, a lot of times for my mommies, if they're like, my legs have been hurting, I do look at their legs to see if they're swollen. Sometimes I'll press them and you can see the fluid go out and then kind of pull back in the legs. Sometimes mommies will mention their vulva. So that area, the vulva is like the outside area surrounding the vagina.
Yes.
And so sometimes people will get swelling there as well. And so those are some of the more common areas where we'll notice the swelling. But typically it's going to be swelling in both legs, not just one.
Okay.
And we can talk about that more in a little bit. Or swelling in the vulva.
Okay, got you. So vulva, the area outside of the vagina, right? The
Yes.
vagina being the opening.
Yes, that
Okay.
opening.
Yes.
Yes, that's correct.
All right. And then,
Oh, can I make one more
yeah,
comment?
absolutely.
Sometimes it feels like heaviness, like more of a heaviness in the legs. A lot of times I do tell people swelling can cause pain. So if they're
Yes.
like, my legs hurt, and it's like, well, your legs are very swollen.
Yes.
That can contribute to pain in the leg. So just something to look out for.
And why would it contribute to pain? What's kind of happening structurally there?
And so imagine, imagine if you had a balloon and it was you had a water balloon. It was already at its capacity, and then it's like, I'm gonna add more water. Usually for the balloon, it's gonna pop. For your body, it's not gonna pop, but it's gonna overstretch those tissues. It's gonna be uncomfortable, like when people can't bend at their joints as well. A lot of times it's because swelling is taking up space where we otherwise would like our body to move.
That makes sense.
Okay.
Okay, so what are some ways that people can manage this swelling?
So I love to talk about compression stockings for almost all of my mommies. Even in that first trimester, I'm like, hey, be on the lookout for leg swelling. You want to start using your compression stockings sooner rather than later. So definitely talk to your provider early about what options look like and if that might be appropriate for you. In some cases, maybe not. And in a vast majority of the mommies, I see compression stockings. Some of my moms have even had, for those with vulvar swelling, we'll wear like a compression short almost to keep that area supported and keep the blood from pooling, keep the fluids from pooling in that area. Some other ways to manage: staying active. Activity is underrated in this, but when you move, your muscles are pumping fluid throughout the body, helping to get circulation. That's why if you see someone post-op from certain surgeries, they'll say pump your ankles or do your knee slides. Just you want to keep the areas moving because we don't want fluid to pool. We don't want blood to pool in the legs or in the vulva or anywhere else in the body per se. Same thing can be said. Some of my mommies, they've had some hand swelling, noticed some limb swelling, and our occupational therapist, or one of the ones I've worked with, has offered different gloves. However, you still want to make sure your provider knows and is aware to make sure there's no scaries underlying the region. And then final commentary on ways to minimize swelling. If it's in the vulva region, oftentimes mommies and I will talk about different inverted positions. So positions where your hips are higher than your head. Laying on the back, that is not a fan favorite, but usually on all fours. I've had moms either place knees on the couch and rest arms on the floor, or even doing common yoga poses.
Yep.
So I think child, we'll say puppy dog pose, might be a little bit more of an opening and able to kind of lift that belly off of the vulva region. Because if you sit all day and the bump is bumping, imagine that the baby bump can compress the nerves or the blood vessels in that pelvic region.
Yep.
And sometimes even the little mommy belts that lift the belly band. I'm going to say the belly band.
Yes.
There's a variety of them that lifts the belly away from the vulva region, and that can be helpful too. Because nobody wants that pain, discomfort, tenderness in the vulva region. One of my friends was like, it looks scary down there. And I was like,
oh God, it looks scary.
She said it looks scary. And I was like, oh no. I was like, did you look? And she was like, I did. I looked with the mirror and it looks scary.
Oh.
And so, yes, we don't want the scaries.
Okay, speaking of scaries, last thing, what are some red flags that people need to know about and seek help for?
Oh, yes. So, yes, swelling in the legs comes up. I think it might be 7 or 8 out of 10 mamas in like 5 months on. However, we don't want to see swelling going through the whole body. If it's your legs, it's your arms, it's your face and neck, then we're starting to look at, and for another day, things like preeclampsia. We don't, and that is more of a blood pressure management issue. So that becomes a different ball game. We don't want to see swelling in one limb and not both. Usually people are like, more is not better. For this, symmetry is everything. If you just see swelling in one leg and not both, then we're looking out for clots. And yes, being pregnant, being in that early postpartum, folks are at an increased risk for clotting. Swelling that doesn't go away when you lay down. If you lay down, you elevate the legs, typically people will say, oh, my swelling goes down by the morning. If the swelling is still the same, that's also problematic. And you also don't want to see discoloration. In the legs, in the vulva, I usually will still tell people something called hemosiderin staining tells you that the blood is pooling and not getting back up to the heart appropriately. And so with that being said, typically that means your veins might not be working. So what's pumping the blood back to the heart might not be working as well as we want it to. And so those are all still reasons to check in with the doc. And then my other comment on pressure, there's mommies on both ends. I'm so sorry, y'all. There's mommies on both ends where the blood pressure might be elevated and then where the blood pressure might be dropping. But if you're feeling faint, weak with position changes, like going from sit to stand, going from laying down to sitting up, that might tell you your blood pressure is dropping. So that's another reason to check in with the doc, because I have had some mommies who were trying to super hydrate to compensate for blood pressure drops.
Okay, very interesting. We really appreciate the short and sweet on vascular changes in pregnancy. For those of you who know somebody who knows somebody, or maybe you are indeed pregnant yourself, please, please, please run this recording back, take some notes, and ask us questions. We love to hear from you. All right, until next time, mamas, stay balanced.